Did you know what one of the most important products in our office is to allay patients' fear and anxiety? It's a tissue box. And the question I have for you is that do you have a tissue box in every room in your office in arm's reach of where a patient is going to sit? And that includes the reception area, the front desk, the financial area, and every operatory. Patients sit in dental chairs. There's always a flat part in front of the chair, and we have a box of tissues there. We don't use them every day, but they're there in case we need them. Dental offices are one of the most emotionally charged places on earth for patients, especially at their first visit. So patients do get upset, and emotionally, sometimes when they get upset, they may hold the feelings in or they may cry. Oftentimes, when they feel relief, they'll cry. About 10 to 15% of our patients in our office do cry on a daily basis, not because of pain, but because of an emotional relief. At that moment when they cry, I need to be aware. So let me talk about one thing first. It's very important to be curious about what your patients are going through, to really pay attention to where they are emotionally, because that's when we connect. Now, once they're sedated and they're anesthetized and we're doing our procedures, we're not connecting, we're doing our procedures. But before then, basically about 50% of the time I spend with a patient is in conversation, speaking with them, making sure that they're emotionally in the right place. And patients will come up with a tremendous amount of emotion. So what do we do at that time? Number one, I pay attention. I acknowledge the fact that they're a little upset, and I immediately hand them a tissue. If I don't do it, one of my teammates will, or the patient may see the tissue. I go, those are there for you. And they usually say something like this: no, I'm okay. I go, it's okay. I will give a patient permission to cry. And oftentimes, because a lot of our patients have had bad experiences in different offices prior to coming in to see us, they don't want to release. But once they release, they feel better. And if that release can come in a supportive environment where my teammates and myself are there for them, handing them a tissue and giving them whatever else they need, they feel better. Now, it's not just tissues. It's not just awareness. It may be a glass of water. It may be a lip balm. It may be just a little touch on the hand or the arm to make them sure that they're in the right spot. And that should all be there in advance. You don't want to say, let me get you a glass of water, let me get your tissue. You want to be prepared. And as I've learned, in residency programs and as a Boy Scout, I was an Eagle Scout, and all of my training by Stephen Covey and the 7 Habits of Highly Effective People, it's very important to do all the little things in advance. So when there is a need or a need arises that's of an emotional, immediate nature, you're there for them. So I just don't want to think about it at the last minute. Oh, let me get your tissue and run out of the room. You want to be there at that moment, because in that moment you connect with the patient. In that moment when you connect with the patient, in their moment of need, and you tell them it's going to be okay, they feel better. And that makes a difference in your relationship. That lowers stress. It lowers barriers to treatment. It lowers all barriers. And everybody wins. The patient wins, you win, your team wins, the world wins. So it may seem like a little thing, having tissues or a glass of water, or just those little things around patients so that they are taken care of when they need to be, but it's important. It's a gift that we can give to our patients. Have a great day, everybody. And remember, continue to be the gift.